Good morning, fellow Rotarians and the broader public of Rotary International. This morning, I have the most wonderful privilege of interviewing the District Governor for District 9400, Rotary, Southern Africa, Dr. Stella Anyangwe. She will be chatting with us this morning about the upcoming soft launch, which is for Rotary Family Health Day, a virtual event that's happening on the 5th of November. Dr. Stella, welcome to the interview. I'm going to deep dive right in and ask you off the bat. We know that getting to many people in South Africa and indeed Southern Africa is a real challenge. Can you paint the landscape for us and tell us a little bit more about that this morning?
Thank you very much, Shereen. It's my pleasure to be here this morning in your interview and to give a little insight into what we're expecting. Yes, well, we live in South Africa. We know that our district has 4 countries: Botswana, Eswatini, the southern part of Mozambique, and the northern provinces of South Africa. But I will only speak about South Africa, which experience I have. So I will not speak about the district as a whole. I don't know what happens in the 3 other countries in detail. Here in South Africa, healthcare is available. I mean, healthcare is at various levels. You have primary care, which is, it's supposed to be universal health coverage, actually. You have a primary care center where you can have from diagnostic to rehabilitative medicine. And this you should find, according to the WHO guidelines, you should find a primary care facility within 5 kilometers of where everybody lives. That's the ideal. Now, we all know, we who live in South Africa, that the ideal is not necessarily what obtains. If you go to big agglomerations, towns, and cities, you can find health facilities everywhere, and people can have access to them. But the more you go into the rural areas, it's not always that. People might have to travel long distances to get to healthcare facilities. Besides that, South Africa, where we live, is a very unequal society, as you would know. If you have insurance and if you have money, you can have the best healthcare in the world. We have people who come here from other parts of the world to get healthcare here because our private healthcare facilities are first class, world class. We have government healthcare facilities as well, which are very good, but you've got to get to them. So your question, it can be answered in many phases. For those people who can afford healthcare or who have health insurance, there's more than enough for them. They've got what they want. For those people who don't have health insurance or who are not close to a healthcare facility, this can be quite difficult. I mean, we have places in South Africa here which are just as bad as many of the less developing countries in Africa. We also know that South Africa has large proportions of the population living in informal settlements, what we call informal settlements here. That is, they live in agglomerations that were really not planned to be habitations, and therefore they don't have services there. So they might not have the regular services that other people have, electricity, water, and definitely not healthcare. That is a big concern here. And this is one of the areas where our Rotary Family Health Days, powered by Rotary, but undertaken by the Department of Health and other partners, this is where we make a big difference. Because in the past few years, we have concentrated family health days in areas that would not necessarily have regular health care. And so it is true, family health days run when we used to run them every year, and that was before COVID. They would run for 3 days. But during those 3 days, people who did not usually have healthcare would be afforded the opportunity of getting diagnostic care, treatment, and referral for what they had. This would take place over 3 days. But then after 3 days, life went back to normal, and people who didn't have healthcare would continue not having healthcare. But at least for those 3 days, it was certain that people who would not have usually had access to health facilities would have healthcare come to where they are. And that was one of the big things about Family Health Days. We took services to where the people were, so that people came in, adults, children, whoever, came in for free and got tested for different things and got referred for different things. Partners, I mean, this public-private partnership, which is the Rotary Family Health Days, has meant a lot to lots of people. But of course, the downside of that is that it's only for a few days. And thereafter, you know, things go back to normal. But at least for those days, we are sure that we provide the services that we do provide with the partners to large parts of the population that would not necessarily have had those services had the Family Health Days not taken place.
So that's an amazing feat to be able to do that in such a broad-based way. But can you tell us, DG Stella, how has COVID impacted on the way that Rotary Family Health Days are rolling out now? What does it look like in these conditions?
Well, before COVID, we advertised the Family Health Days. The partners in the Department of Health would go in the communities and really work up the communities to come forward and get services. Therefore, during the 3 days of the Family Health Days, we would have throngs of people, lines of people coming, waiting to be served and being served. So there was always a grouping, a big grouping of people. Now with COVID and the social distancing protocols and the fear of infection, you can't do a thing like that. We know that it's just over a month or so ago that we moved to COVID level 1. We know that we've gone through levels 4, 3, 2, where you couldn't have more than 50 people in a ceremony or in a funeral or things like that. So it was difficult then to have your regular Family Health Days where you would call the populations to come and get services. So that was the difficulty during COVID. And we are not out of the woods yet with COVID. We still have, even though we're in level 1, we still have social distancing protocols to observe. We know that it would have been different if the entire population had been vaccinated, because vaccination protects. It protects not only the person who's been vaccinated, but it protects those who are not vaccinated. But because the levels of vaccination have not got to herd immunity yet, 60, 70% of the population, there's still a big risk of people being infected. And vaccination doesn't mean that even those who are vaccinated will not get COVID. Therefore, we don't want to take that kind of a risk. And so we will not have the regular, usual Family Health Days where we just called on everybody to come. What we are planning for, which will be launched on Friday, is a more subdued event. It will still be an event where people come to get, but it will be a selected number of people. We will not just open up to the whole community to come and get healthcare. And because this year they're focusing on people with disabilities, it will be sure that there will be more people, bring in people who have disabilities who might not necessarily have got these services to get the services. And of course, this year, because we are already vaccinating for COVID-19, COVID-19 vaccination will be part of the services provided.
That's absolutely amazing, DG Stella. We have Annemarie Mostert who's joined us, and I think just for a few minutes in our meeting today. Welcome, Annemarie, the previous DG of the district, did amazing work around Rotary Family Health Days. If I could just ask you to unmute yourself. I have two questions for you quickly. The first question is obviously that Rotary Family Health Days are so broad in terms of the service they provide, and you are spearheading a project this year which is empowering the girl. And part of what Rotary Family Health Day does is actually to offer a lot of services to women, which indirectly is empowering those women. Can you maybe talk to us firstly, Annemarie, about the kinds of services that are available to women in terms of healthcare at Rotary Family Health Days? And then secondly, would you touch on the enablers of this event, obviously government being the biggest partner, but then also the sponsors that are really come on board and really supported Rotary and Departments of Health in this venture. So there are two separate questions, and if you could lead into those two, please.
Thank you so much, Shereen. And yes, listening to Dr. Stella, I mean, what a privilege. You know, she's a lifelong member of Rotarians for Family Health and AIDS Prevention. And so we are very honored to have her as a district in our district, also leading after last year, as Dr. Stella was indicating, we couldn't actually host such an event. And this year, it will be a very small scale. But let me talk to you about the past services that we've offered to the communities. And I think that is very important. The clubs are all autonomous, and clubs embraced this incredible opportunity to reach out in this collaboration, as Dr. Stella was also saying, the PPP, public-private partnership, the biggest Rotary public-private partnership in our part of the world. And therefore, the clubs help then to mobilize additional services that it's not rendered by the National Department of Health, or also the clinics and the province, and then bring that to the community, those that is in it. For instance, mental health. We had dentistry. We had mammograms. We had reaching out to the women, actually indicating in some of the sites, what does it mean to have a good, healthy, nutritional menu to the little ones, maybe that is under your care. So the most important is that this is neutral ground. The gates are open. You come from all over and you get your test done, you get the reference done, but then also those additional services are rendered. We had incredible programs that the clubs did, even eye testing with eyeglasses, even the dentistry showing the little ones how to brush and what to do. So they are from empowering girls or empowering our children. There are additional services to the mothers that bring those little ones, the gogos, the mothers that come and bring them to say, yes, my child, is this child healthy? And the practitioners are just incredible. And then also the various medical doctors within our district and our clubs reach out to the communities. Now, let me tell you where it started. It started in this very district, the first Rotary Family Health Day interaction some years ago, 10 years ago to be precise, in Zandspruit. And we were very fortunate that the RI president at that year actually attended, as well as the National Minister of Health. Similar to this year, where we will have the highest support from our Rotary International leadership, as well as from the National Department of Health. Those partnerships are critical, but then it's also the additional support that we are receiving from corporates, from the SABC, from the Caxton newspaper, from Hunter Group, a company that came on board this year as our media sponsor and partner. We can't do it without our media and our other supporters, because there are additional services that need some support, and sometimes just a little stipend to make sure that the people are travel from their destination to the site. Somebody needs to do that. In the past, we had Gifts of the Givers. We've got the different foundations, the Skim Foundation, we had MTN, we had the Coca-Cola Foundation. It comes a long way because it's reputable organizations, but then also, I think Dr. Stella are more, I want to say, qualified to speak on the World Health Organizations, the PEPFARs, the USAIDs, and those CDCs, those guys that make it really happen, not only for Rotary, but for the communities and also for our department. And therefore, I want to say thank you so much for also asking the leadership in our district to share from their experience. This year, we're very fortunate to have the most accomplished and the most qualified person in our district that will host the hybrid event on the 5th of November. And I'm going to hand over to you, Shereen, but I want to recognize you as our media sponsor this year. Thank you for also your contribution.
Thank you so much, Annemarie. It's an absolute honor and pleasure. And, you know, I get to see firsthand exactly the work that goes into it and the results of it doing these interviews. I had the most phenomenal interview with Sarah Kamalo, who was a lady who, as you know, ended up in a car accident and ended up in a wheelchair. And to listen to the world from her point of view in terms of how Rotary is changing her life and touching the lives of people who have disability is absolutely mind-blowing. And you cannot help but engage and be committed when you see these results through Rotary. I mean, the 1.2 million members in Rotary that join hands for these 3 days around the world is absolutely amazing. So thank you very much for leaning in, Annemarie. I appreciate it. I know you have a lot lined up for today, but thank you for joining us just for a few minutes to share from your point of view.
Thank you so much, Shereen. Thank you.
Pleasure. It's a pleasure. DG Stella, tell us a little bit about the biggest stakeholders that are involved. I mean, you sat at a World Health Organization level, so you know firsthand. Tell us what that picture looks like.
Thank you so much. You know that in a country, the health care of that country is in the hands of government, usually. Government provides for its people, but governments cannot do this alone. And therefore, everywhere, governments look up to partners, be they UN partners, be they bilateral or multilateral organizations, governments look to partners for support in providing healthcare to their citizens. And this is not only in developing countries, everywhere governments cannot provide healthcare alone. And therefore, South Africa has been very fortunate in that for its Rotary Family Health Days, both when it was fully operational, they have always had a lot of partners, And Annemarie had named some of them. I mean, you have non-governmental organizations in this country, local non-governmental organizations and international non-governmental organizations that have projects ongoing in the country. And during Family Health Days, they call these NGOs to be part of that Family Health Days. So you would go to a Family Health Day site and you would see a USAID funded project there doing screening for women, doing HIV testing, doing testing for diabetes or for hypertension. You would find local NGOs which deal with HIV and AIDS distributing condoms, distributing other family planning tools. There was just always such a mix of donors and people who helped so that the Department of Health would not be doing this alone. So you also had Department of Health people, in fact, those who called together the community, who made the announcements, who did the announcing and the social media, were all people dealing with the community health workers of the Department of Health. So this has always been a big, during Family Health Days, it has always been a big display of the goodness of partnerships, public-private partnerships. It has always worked, and we should always continue to keep it that way. That's how it should be. Thank you.
That's amazing. That's amazing what you say, DG Stella. And you know, it's because of women like Sue Paget, who is the global CEO of RIFA, that we are able to achieve this public-private partnership. I love what you said. I wrote it down here, and I'm going to broadcast this loud and clear because we share a value. You said government cannot do healthcare alone. And I think that's the responsibility that falls back on us as private sector and civil society to join hands with government, in this case, our national departments of health across different African countries, and really bring resources and solutions to the people. So, DG Stella, thank you so much for your time. Annemarie, thank you so much for your time in leaning in this morning. We are just a few days out of the soft launch that is happening this week, Friday, the 5th of November, a virtual event. I'd like to invite as many people as possible that are watching this interview. Please click on the links that will be shared with all of these interviews. Register online, listen to our Minister of Health. He's going to be there. He's going to give us a word for the day for RIFA, Rotary Family Health Day, and the public. From my side, Shereen Hunter, I say goodbye and I wish you all a wonderful week. Thank you so much for the interview.
Thank you, Shereen, and see you on Friday.
Thank you.
Thank you, Annemarie. Bye-bye.
Bye-bye.